Chris from ChristopherHall.com, and welcome to this video where we're going to be going through an introduction into lower back pain. A little bit more about what it's about and some of the major conditions, or common ones. I won't say major ones, but common ones. Because there are a lot of different types of back pain out there. There are lots of different symptoms that people have and different types of injuries that people have. And what we're going to focus on in this video is some of the more common ones, or certainly the more common ones that I tend to work with and tend to come across. And obviously the one at the top, which is the one that I had when I was younger, when I was growing up, which was my back used to go into, or my lower back anyway, used to go into spasm and used to be very painful. But enough about me. So in this video we're going to look at these three sort of major types of back pain, if you will, different flavours of back pain, if I could call it that. Like I said, there are different ones. The first one though is back spasm, and like I said, this one's a little bit more sort of closer to my heart because it's the one that I had when I was younger, and it's when a muscle spasm occurs in the lower back. It's an involuntary contraction and it causes a great deal of pain. It makes your lower back very, very stiff, very immobile, and in some ways it kind of immobilizes you as a person. It's not very easy to move around. It's not very easy to stand up, sit up, and all those types of things. I can remember a time where I would be on the sofa, led on the sofa for 4, 5, 6 hours at a time because my back just simply wouldn't let me move. And what's causing it are a lot of small, incorrect movements that over time accumulate, and then eventually just come out in one big fail swoop. To protect the lower back, so the muscles tighten up around the lower back to protect it, and then you get what's called a back spasm. So you may have been picking a pen up from the floor, you may have been reaching across your desk, you may have been trying to lift something into the back of your car. It could be something very innocuous. I know someone who's sneezed and their back's gone into spasm and things like that. So there's a lot of different causes for back spasms, but the main thing is to overcome them is just use your back properly. Don't use it too much, and also use it correctly. Keep it in its correct posture and things like that. But I'll talk about that in future videos. This is just simply an introduction to some of the different types of low back pain that are out there. The second one is this one, which is bulging disc. And a bulging disc is where the fluid on the inner part of the disc moves its way through the outer wall, and then it pushes on a nerve. Now, if you can imagine a disc, like a very big round disc, but you got yourself a disc there, and in the middle you got a little sort of pocket of gel, for instance. And that fluid moves gently through, and then what it does, instead of breaking through the final sort of part of the wall, it just pushes on it and sort of pushes it and elongates it, and that's what touches the nerve and aggravates the nerve. So obviously what then needs to happen is that needs to then sort of come back into place. So it doesn't actually break through the fibrous part of the wall. Whereas when we look at herniated disc, the process is pretty much the same. It's where you've got the wall there, and then the fluid gradually moves from the centre, moves, but this time it breaks through that wall and then comes out the other side and sort of goes into the parts of the spine and aggravate the nerve in that way. And that's the one where they obviously but they obviously suggest surgery to obviously open it up, patch it all back up again, and then go about life. With regards to causes of bulging and herniated disc, again, it's using the spine properly. To quote the definition, it's spinal flexion under a moderate load, or repeated spinal flexion under a moderate load. So the more we are bending our lumbar spine, the more that's acting a bit like, if you can imagine that, it's sort of pushing and pulling. If I was to take a seed in between my thumb and index finger here, and I was to push down on the front, obviously the seed is then going to pop out of the back, and that's in some ways that's kind of what's happening with herniated and bulging disc, is in the fact that we're sat for so long doing work at desks. We're doing poor exercises in the gym, like sit-ups and crunches and leg raises and all those types of exercises, which are flexing our spine, and it's those that are causing the fluid to move towards the back of the disc, and then eventually either bulge the disc or to herniate it and it pushes through the disc. So to overcome both of those, again, it's using the spine properly, it's moving from the hips, it's not doing too much spinal flexion, because you're never going to go through life and never bend your lower back. What we need to be able to do is manage what we do, use our back properly, and then on the odd occasion when it so has to happen, then we can go about, flexing the spine, as it were, so picking things up incorrectly. But for the most part, we want to be keeping our natural curve in the spine, keeping the tummy locked in nice and tight, and using the hips to move because they are ball and socket joints. But I'm starting to go off into a whole new subject, and I'll leave that for another video. So many thanks for watching. My name is Chris from ChristopherHole.com. Please come to the website. I've got a 12-week program on there for back spasm, for disc herniation. So if you're there and you want to overcome that, by all means come along and download the program. Also, there's lots more videos on the website regarding lower back pain and the different injuries, lumbar lordosis, back spasms, herniated disc hernia, bulging discs, and things like that. So please come along to the website. It'd be great to speak to you again. My name is Chris from ChristopherHole.com. I'll speak to you in a future video.